And welcome back to another video. And today we're covering the five-part series. We are on our fifth part of the series. Was can non-doctors own a medical practice in Texas? And we've really through this field guide that we built out, we've addressed it in these five different questions. And so now, Mike, we're down the very last questions. And now we've been getting a lot of feedback with additional questions. But today it's really about, can a non-physician hire a Texas medical doctor via just an independent contractor agreement?
Well, as you know, Brad, this is somewhat of a loaded question. So the answer is yes, if it's done correctly. And the reason for that is that the most common way to actually implement this model, called the MSO model, is an independent contractor type relationship through what's called a management services agreement. And so on that side of the equation, it is the way to do this. And it's a safe way to do it. It's the common way to do it. And you have some parameters that you want to follow. If you just go through the field guide, it's pretty easy to discern, when we talk about levels of control and flow of funds. But that's the MSO model. On the other hand, it's really common for even some attorneys in Texas to talk about what they deem a quote loophole, where there's this idea that a non-physician owned practice could sign a medical director agreement with a doctor in an independent contractor relationship, and that's okay. And according to the risk assessment that we found through the field guide, it's not okay. I mean, if you are controlling the decision making, the clinical decision making of a doctor, or the funds are flowing into an entity that's not doctor owned, you are at risk for enforcement of a corporate practice of medicine violation, whether by the medical board or even if you have a civil case in the court system that would be deemed an invalid relationship.
Yes, I agree. And so again, if you go back, you'll see our five-part series. Obviously, there's a lot more details than that. But that's all the time we have today for today's video. So thanks again for joining us.